Hey everybody, welcome to this Coast Caregiver Coffee. This is episode 9, the first one of August of 2020. Today I'm going to be talking about patient priorities. So we're all patients at some point, and whether it's dementia that's going on in the in our lives, or it's some kind of age-related chronic condition, it's important to be able to balance everything, and it's different diagnoses, medications, procedures that are needed, or procedures that are elective. So we'll talk about that in a moment, but first let me tell you a little bit about me and what I do with the Council on Aging. If this is your first time, we've been doing this. We did this 4 times in June, 4 times in July, and we'll continue to do this into the future. But my name is Matt Estrad. I'm a gerontologist in the greater New Orleans area, and I've been partnering with the Council on Aging in St. Tammany for over 5 years as a care partner or caregiver support group facilitator, leading these groups 4 Tuesdays a month for those 5.5 years or so. And we basically get together and we talk about who we're taking care of and how that's impacting us, and we brainstorm and we vent. And we are solution oriented, where we try to help each other solve issues and make recommendations. And as we're all kind of caregivers, now not everybody is caring for someone who's living with Alzheimer's or another type of dementia, but certainly I would say that most of them are that. But we get caregivers that come in that are taking care of somebody with diabetes or bipolar disorder or cancer. So if you are a caregiver or even just a family member of someone with a chronic condition, and you're trying to get a kind of handle on what's going on and want to use us as a sounding board, we certainly welcome you to join our group. Since March, when the senior activity centers in both Covington and Slidell, and actually all of them, have closed temporarily, we've gone to a virtual platform. We're on the Zoom platform, which gives enough privacy for what we need. And we meet every Tuesday, either at 12 noon or at 6 p.m. It just kind of depends. We go back and forth on the time so we can get so it's convenient for as many people as possible. Tomorrow, if you're watching this on August 3rd, on this Monday, tomorrow's session, which is on August 4th, is at 12 noon. If you would like to join, or you just simply have questions about the caregiver support group, I encourage you to send me an email at right here, matt@carepartnermentoring.com, and I'll get back with you. I'll send you the details, answer questions, all that kind of stuff. So I opened up the video and talking about chronic conditions, and sometimes there are decisions to be made. I'm going to play a video that's really interesting. It's actually a brief training video for physicians and other medical providers that talks about prioritizing care. And then I'm not going to go anywhere. I'm going to offer some commentary afterwards. And while this is for physicians and other medical providers, it's important that we as patients, which are really consumers, we consume healthcare, right? We understand that if our physician is not bringing up these types of questions to us, it's up to us as the consumers to bring up any of these concerns that we have. And it's really about what's most important to you as a patient, as a healthcare consumer, when we're trying to managing all these different things that are going on. So let me go ahead and play this.
Dr. D strives to deliver great care, but the way we approach medicine these days often gets in our way, especially when it comes to her older patients. Patients like Mrs. B, a widow who at the age of 77 presents with 21 active health problems, 11 different medications, 9 other treatments, 8 specialists, and 1 pooch with problems of her own, who has become the most important thing in Mrs. B's life. When it comes to Mrs. B, a lot of smart but often contradictory medical opinions get voiced. And sometimes the most important voice of all can get lost. That of the patient herself. Treating any one of these health problems has the potential to make another worse. Addressing them all is a heavy load, filled with potential harm and conflicting recommendations. And the best treatment for Mrs. B is uncertain, partly because people like Mrs. B are usually not included in clinical trials. And even when they are, the trials often don't address the outcomes that matter most to the patient. Mrs. B drags herself to clinician after clinician. Each of her problems seems to complicate another.
Somehow I end up feeling worse and worse. There has to be a better way. I think there is a better way.
Dr. D knows that Mrs. B specialists are highly trained experts, but when it comes to what matters most to her, Mrs. B is the expert. So Dr. D's office has adopted a new approach that taps into that expertise: Patient Priorities Care, or PPC. Several of her staff, her nurse and medical assistant among others, have taken online training in PPC. The PPC process involves helping patients identify their health priorities, the health outcome goals they most want to achieve, and the care they are willing and able to do. And that helps clinicians align their care with these priorities.
I want to go out with my dog and see my neighbors. I like talking to people. And I can't get out if I'm dizzy and tired all the time.
Mrs. B's health priorities are recorded in her electronic health record, which puts everyone on the same page. Her clinicians are now able to negotiate collaboratively with a focus on Mrs. B's desired activities instead of simply her symptoms, and on her healthcare priorities rather than just managing her individual diseases. For example, Dr. D thinks several of her medications and conditions could be causing Mrs. B's dizziness. She considers stopping some medications or adjusting doses of others. Her cardiologist, however, is concerned about changing any of Mrs. B's cardiac medicines. They brainstorm, knowing there isn't a perfect answer, and agree to a series of trial changes in her medications. Through ongoing monitoring of Mrs. B's ability to do her desired activities, Dr. D is able to reduce some medications and eliminate others entirely. They agree to add physical therapy, which Mrs. B is willing to do to improve her balance and walking.
I've been able to walk my dog a bit more and even chat with my neighbors. We are going to watch closely to see if you're able to do the things you want and are less overwhelmed by all your health care. Thank you. It really helps being part of the team. Thank you for helping me to provide the best health care possible.
To learn more about the Patient Priorities Care approach and to access resources for your practice, visit patientprioritiescare.org.
All right, so I hope that was helpful for you. So like I said, even though most of us are not.
CCSD TV program is presented by...
So while I feel like I'm addressing more patients and healthcare consumers than I am physicians and other medical providers, which that video was intended for, I think it's important to realize that that it's okay to look at medications and to safely talk with your to talk with your physicians about safely deprescribing, about looking at, do we bring in physical therapy, looking at medications that might be impacting the others and getting side effects and whatnot, and really figuring out what's important to us as we grow older. And you saw the video, the patient said that it's important to me that I'm able to go out and walk with my dog. That's what's important to her. And there were certain things that were happening that were preventing that. So my encouragement is that you work with your physician, you work with your family, and that you're able to go down this road and figure out, make sure that you know what is important to you, make sure that all your medical conditions are being managed, but also they're not being overly prescribed and overly focused on and having a really good balance. So I'll leave you with that. I hope this is helpful. That video, it's on YouTube, and you saw the website, so you're welcome to share that with others. If you like this video, please go ahead and let me know. This is the first time I've shown a video as part of the Caregiver Coffee and made a comment on it. So if you like this format, maybe I can find under other videos. Just let me know in the comments, or even better, shoot me an email. Let me know if if these are you appreciate the Caregiver Coffees, and I'll pass that feedback on to the rest of the Council on Aging. So again, my name is Matt Estrad. I'm a gerontologist, a caregiver support group leader for the Council on Aging in St. Tammany, as well as a dementia coach. So I do personal one-on-one coaching also in the area and field of Alzheimer's and different types of dementia. So I hope you found this helpful. Please let others know about it, send feedback, and I will see you next Monday at Caregiver Coffee. Take care.